Hello and welcome. You're watching SA Today. We go straight to Nairobi, where the WHO is holding an emergency meeting talking about the coronavirus. Let's cross there live now.
In countries, what they will do. So, as you are probably aware, this is a new coronavirus that started spreading in Wuhan in China and has now spread to 61 countries worldwide. We've seen an extremely dramatic exponential growth in the number of cases and in the number of countries that are affected. And currently, the latest information is that there have been 88,000 or so confirmed cases. And as we know, this is an infection in which people can be asymptomatic. So the assumption is that there are probably many more people who are infected with this virus, which is one of the concerns as far as then preventive measures and control are concerned. We have, as far as the African region is concerned, we have 3 African countries that have now confirmed cases. One of them is Egypt, which is on the African continent, but is within WHO, looked after by our Eastern Mediterranean Regional Office. And then we have 2 African countries, Algeria and Nigeria, that have confirmed cases. That simply, if you like, sharpens the level of concern, heightens the work that is happening to build countries' capacities to be prepared to address this outbreak. Our member states have done a lot of work in the last month in order to build up this preparedness, starting, first of all, with establishing diagnostic capacity. At the beginning of the outbreak, we had only 2 laboratories that were able to diagnose this virus. As we speak now, I think we have about 33 laboratories that have worked with support from WHO. And I have to say that we have built this upon a laboratory network on influenza that was already existing, that had been established to deal with the previous flu-like virus outbreaks that happened in the past. We already had a number of laboratories which were carrying out surveillance for influenza viruses in the region, and it simply needed then additional training of the healthcare workers and the kits that are specific to this virus to be put into place. In some countries, they've had to buy equipment. They've had to, of course, procure kits, train healthcare workers, train the laboratory technicians, and we expect that in the next couple of weeks, we should have all the countries able to diagnose this. This is extremely important because the sooner the diagnosis is made, then the sooner that the measures can be put in place to contain the further spread of the outbreak. We are concerned at the global level by the fact that such a rapidly growing outbreak has caused or is causing a challenge in the availability of certain key materials that are needed, particularly personal protective equipment, things like gloves, masks of the right type to be protective, particularly for healthcare workers who may be the first to be exposed by somebody who feels ill and reports at a healthcare facility. So there's a lot of work going on with partners to promote and stimulate production, expansion of production of these materials, and ensure that countries that may have challenges in terms of resources are also supported by WHO to be able to have supplies of these materials. So just to say that there is a global movement ongoing. The WHO Director General has established contact with key partners, briefs the UN General, the leader of the UN at the global level regularly on what is going on, is working with different partners to really try to mobilize all the support possible for countries. Member states have themselves put in place their own mechanisms for coordinating their response, are starting to implement different components of a response and ensuring that they have rapid response teams ready, diagnostic capacity being put in place, case management being organized, point of entry screening of travelers being organized. And I have to say that it is through point of entry screening at airports mainly that some of the cases have been discovered, have been screened, and confirmed in countries worldwide, including in the African region. So we're here expecting by the end of tomorrow to have agreed a plan with our regional partners of who will do what, who will lead what component of the support to countries to make sure that we are prepared on the African continent and our countries build up their capacity to respond to this outbreak. I'll stop there and wait for your questions.
Hi, I'm Ingrid Formanek with CNN. You said, as you noted, it's asymptomatic very often. Mm-hmm. Are you working on the assumption that there are a lot more cases on this continent as well as elsewhere, but there are a lot more cases other than the 3 cases that have positively been identified?
I think there could be cases on the continent as there probably are many more cases in the country that have confirmed cases than the people who get ill and are tested and confirmed. As I said, we have an influenza laboratory surveillance network in the region, and what we note is that we have not yet observed clusters of cases themselves. I think what we assume is that where you are seeing cases, there are also very probably asymptomatic people, some of whom will become symptomatic. And that's generally the case where there are cases already. So this virus is circulating very widely. We have not yet seen on the African continent an increase in clusters of influenza-like illness yet reported, at least in the countries where we have the surveillance going on. But I think we cannot exclude the fact that there could be some people who are infected with this virus who are not manifesting symptoms and who have not been tested.
You know this quotation that's attributed to Bill Gates that was published in 1 or 2 newspapers where, and I don't know if he's being alarmist or not, but he had a very dire prediction for this continent. Do you think that was unnecessarily alarmist?
I think it's correct to be concerned for a continent whose health systems, surveillance capacities are not what they could be. However, I do think that it's important that we base our predictions or estimations on some sort of evidence. And as I've said, one of the facts that we do know is that we have established now point of entry screening in most of the countries in the region, and they have picked up suspected cases and been able to exclude that they are cases. And as I said, we have a surveillance network on influenza, which has not shown any particular pattern that might be suggesting this would be the case. And I think thirdly, we generally get our flu season a few months from now in the African region. So perhaps I think we should be concerned about time is moving. We're getting on to where in Southern Africa, for example, we're starting to see people with influenza. So we need to consider all of that. I think it's very important to be concerned. It's very important for countries to do everything possible with the support of partners to be ready, not only for containment, but also for the scenario that there may be cases. What are we going to do then? So we need to be working on 2 fronts, containment and also providing care, ensuring that we don't then get from the first few cases an exponential growth in the number of people who are infected.
President of CNN, ma'am, is everyone who was on that flight that brought the man from Milan in Lagos, are they all being watched at the moment? All the passengers that were on that flight?
The government, I know, has tracked back to all the people that they could trace who were on that flight, and they are keeping in touch with them. I mean, it's not possible for me to say they were able to find 100% of the passengers who were on that flight. Perhaps we can refer back to the Nigeria CDC and get the real information about the extent to which they were able to trace back those passengers on that flight. But generally, what does get done is to register passengers that are coming out of flights. I myself had to fill in a form this morning at the airport as I was coming in to say where I was coming from, where I was going to be staying, what seat I had been on, and that's the way in which they can then trace the people who were closest to somebody who turns out to be a case.
My name is Sarah from the South African Broadcasting Corporation. Initially, you had 13 top priority countries on the continent. Are there still 13? And are you satisfied now with the preparedness that you have put in place? Assume the disease came to any other country, especially in sub-Saharan Africa. Is the continent now ready?
Yes, we had classified countries in 3 groups: the highest priority, the next level, and then others who also, at that time, the focus was very much on links with China. So these were looking at volumes of traffic, travelers from China to these countries, and then looking at countries that serve as flight hubs to China. We did a lot of work with those countries, and as I said, one of the indicators of progress there was the number of countries that could, within a couple of weeks, literally, be enabled to have the diagnostic capacity. Point of entry screening was scaled up. The surveillance, not only at points of entry, but also in the health system, was improved in countries. We know that there remain certain areas where we need to do much more work. One of these is in infection prevention and control. So to make sure that not only is, this is particularly important around the healthcare setting, making sure that healthcare workers are reminded of the basic hygiene measures with which they have to take care of sick people, that the equipments and the materials, the supplies are in place. This is still a challenge because, as I said, there's a global shortage looming of these. And then also case management in terms of having all the equipment that is needed to care for somebody who gets a very severe respiratory illness. So these are some of the areas in which work is still needed. Of course, now that the dynamics of the outbreak has changed so dramatically, we are needing to review this categorization of countries. Now, instead of just China, we have 61 countries affected. And in fact, the first couple of cases in the African region came from Europe and not from China. So we are needing to review this categorization. We are concluding that with the type of contact that there is between European countries, for example, and many African countries, we just need to expand this support, which is why, one of the reasons why we are organizing this meeting with partners, so that we can simultaneously work with many countries to improve their capacities. One of the advantages, I might say, of having had the Ebola outbreak in the DRC in place for a year and a half is that we've been working on preparedness with many African countries, and we have been able to build on that, on the ongoing work with them to address specifically this coronavirus outbreak.
But what does this say about African health systems? Where should African governments' priorities lie? Now that we have this challenge, we have had Ebola before, what lessons are we learning?
I think this just reinforces the message that, by the way, political leaders in Africa and worldwide themselves have recognized when at the UN General Assembly they held an event. There was a special high-level event on universal health coverage in which they made certain commitments to invest more in improving the capacity of their health systems, not only to provide essential care to the population, but also to be more resilient and more robust to the threats such as outbreaks coming from this virus. That means not only addressing immunization of children, making sure that women don't die in childbirth through maternal health services, but looking at the international health regulations related capacities. So your capacity to do surveillance, to detect quickly an outbreak when it is starting, to respond and contain it, starting from the community level right up to, if you like, the district level, to making sure that you have healthcare facilities where if somebody is ill, they will be seen by a nurse or a doctor who will suspect that this is a bit strange. I'd better refer this case to those who are dealing with outbreaks. I think it reinforces that. And I am expecting that following this outbreak, which is having, because it's ongoing, is having such a dramatic impact not only on the health of people and killing some people, but on the economies internationally. We're just hearing about the dramatic drop in the value of shares internationally. So this is one of the, if you like, risks of not investing sufficiently, not only in African countries, but worldwide, in preparedness, in health systems that are robust to outbreaks and are also able to provide in a just and equitable way essential health services to all their citizens.
And finally, just last week, South Africa announced that it is evacuating her citizens. We've seen other countries doing it. Is this the right time, and what should happen once countries decide to evacuate once these people are in the country?
Yes, well, first I think it's an individual country decision whether to repatriate their citizens who have been in China. Yes, I did follow myself. In fact, the press conference that the South African Minister of Health with a number of other ministers held in Joburg, they've taken this decision now. What's important is for a country to have the capacity to then manage this process of repatriation, not when they arrive home, well before they arrive home, when it is being planned, looking at what is the risk among the group during the transportation, during the flight, and having put in place all the provision when they arrive back in their countries of ensuring that they do not then get out into the community immediately, that there is monitoring of these people, ensuring that any cases among them are identified, and of housing them in whatever quarantine facility in such a way that this does not become the occasion for the infection to spread among this group of people. So it requires meticulous planning and preparation and certain capacities in a country if they're going to take these decisions. And of course, it requires very much good communication with the rest of the population who see what they might consider a risky group of people being brought back home, so that unnecessary fears are dispelled. And I think just underlining the importance of communicating with the public in general about this outbreak, so that people take the necessary measures, hygiene, especially hygienic measures, without panicking and overwhelming clinics and health facilities when they think they might be ill. What's it?
If I just may ask, you're talking about concern about overwhelming facilities. Do these countries that you're working with, you said 40 so far, do they all have the capacity to handle it themselves, or will they need health workers from outside of countries and supplies and funding to help set up properly? Because, as you know, infrastructure is weak already, and there's so many other diseases that ring the alarm bell.
Yeah, I mean, they certainly need funding, international funding, part of which will be to bring in those expert teams who will have to very rapidly ensure that the core group that's managing and leading this response in the ministry is up to speed in terms of their knowledge, their access to the different guidelines that are being provided, and is capable of organizing this preparedness and this response. And as WHO at the moment, we have I think almost 50 of our experts out in countries. They will definitely need funding to bring in some of the additional equipment and supplies that they will need to be able to respond. I think from the perspective of having healthcare workers from other countries, you mean more doctors and nurses to be able to help them in the health facilities. Of course, there are many shortages of healthcare workers in countries. I think the question is whether you would be able, now that this is an outbreak that has gone worldwide, to be able to obtain the kind of people who will be able to go to a primary healthcare facility and expand the number of healthcare workers. So I think what's very important is to get the most, if you like, accurate evidence-based interventions being put in place in the highest risk places even within a country, because in each country we're helping them to do their own risk assessment. It's not as if the outbreak is going to spread everywhere all at once, but there needs to be a focus on those areas highest at risk to help to contain and to minimize deaths, and then to look at other places as well. So what will probably be available and what countries need the most is the financing, the technical advice and support to put in place the most correct plans, and then they will have to, as we call it, repurpose their existing healthcare workers. So make sure that people are moved, if necessary, to the highest risk places to support that, and have a fairly flexible way of managing your internal resources.
Is there such a thing, for example, because Kenya was on, just because we're in Kenya, I'm using it as an example, it was named as one of the 13 top priority countries on the continent, the population being 40-odd million people. Is there some sort of formula that you can say high-risk country, population this, healthcare is this? Is there some sort of formula you're working on, such and such a country needs a minimum of this amount of beds potentially? Is there any sort of a formula that you can work with to be able to prepare? countries?
Yes, I think we're working on that, because at the end of the day, you need to quantify what will be needed. This is what will enable you then to mobilize the resources that are needed to put it in place. I think we'll be looking at the dynamics of the outbreak in the countries where it's happened, and this is something that we're having to learn as we go along, because it's evolving very quickly. But at least we are defining the minimum capacity that has to be put in place in the highest risk places in countries in order to be able to manage, contain, and then after that it's a matter of adjusting and adapting and building on different scenarios really in this preparation in countries.
If I may add, the first prioritization was really based on volume, and that's why Kenya was on contracts with, as Dr. Moetia said, contracts with China, and then that was the only epicenter. So we had those 13 countries, but that situation has since changed, so we are then reprioritizing. The prioritization was also based on the international health regulations core capacities. Every year we assess a country's core capacities in the international health regulations, and we look at critical pillars for preparedness, response, and detection. And so we categorize them for countries that had the strength. We've also done a baseline assessment based on the COVID readiness assessment. Now, in terms of preparedness for like admission of cases, as you know, about 14% is the severe form, and then 5% is critical. So most of the cases for COVID are asymptomatic. So, but the issues that would then be required would be case management facilities, and really what we are seeing in those countries that are most affected is that high speed oxygen really is a lifesaver, and that is something that we in Africa is a new challenge that we have to deal with. We've developed isolation facilities for Ebola, but this is a new challenge, and we are now trying to advise countries to be able to set up this kind of facilities as well.
Okay.
So, thank you very much. Maybe now we shift to the one-on-one. For those of you who haven't asked any questions, Reuters, BBC.
Okay.
Go fast.
Joe Biber?
So how are you? Doing this.
So for the one-on-ones, how because we need to set up move the chairs a bit.
You want to move chairs? And that's for everyone, right?
Yes, we need to
One after the other.
move away from the table.
Oh, okay.
Okay.
Like around here?
A chance to stretch my legs. Okay.